So you asked about how did I treat Tanya? And it's hard to show a lot on video, but one thing that's valuable in the treatment of anything in the upper body is to find points in the neck that need to relax without even a strong focus on where they are, although there are certainly spots where I look.
Right.
So this, interestingly enough, is called naso in Japan, which is the word for braille. So it indicates how much it depends on the sense of touch. And it's easily demonstrated. Initially, what I want to do is simply induce some relaxation at the surface. So I simply touch the end of the needle to the surface of the skin, and that changes the circulatory pattern. And then once I've done that, I will look for indurations. We'll look first along the collarbone, near the attachment of the sternocleidomastoid muscle. And this needle is blunt. This is a blunt silver needle. It doesn't even go into the skin. So I lay it in there and I advance it so that I can feel the hard spot, feel some resistance. I may insert with this technique, but we're not inserting for demonstration purposes. But even so, if I press against the skin at that hard spot, silver is very conductive. One can begin to feel a change. One can feel a stickiness at the end of the needle. And this indicates that the circulation is changing at the point. It's easier to do with a little insertion than with this pressing needle technique. But even with the pressing technique, we can, there, it changes. Okay.
And thus you don't even look after all because you're relying on your sense of touch?
Oh, yeah, sight is unimportant at this point. So we'll look along the margin of the sternocleidomastoid muscle a little further up. Just looking for a good spot to release some tension. So release tension doesn't speak adequately to what we're doing. We're really changing circulation.
In a pattern that will continue well after the appointment, right?
Yes.
For hours and days and...
Yes. This is a supplementary technique. In the whole scheme of things, this is symptomatic treatment. Before this, I do treatment to supplement or build the body deeply, at a deep level. What do I mean? I treat meridians. In Tanya's case, I treat primarily the kidney meridian, secondarily the lung meridian. There we go. See, there's a change at the tip of the needle. Things soften. Because I'm not inserting, you can't see any redness. But now let's relax.
And what portion of the treatment do you do this?
Oh, I don't know.
Is there no set? It could just vary depending on...
Yeah, well, there's some focus on this with a situation like Tanya's. But still, maybe 10% maximum.
Of the overall treatment time?
Yes.
And Tanya, what kind of sensation does it? Yeah.
No pain at all. I actually feel very relaxed. It's a Tom touch. I don't know what he does, but every time he starts treatment, I'm ready to fall asleep. Very relaxing.
Very good. That's a good way to conclude this portion. Unless, Tom, is there anything else you would add?
We can also extend this to just changing the circulation on the upper back. It's called scatter needling. I'm simply touching the skin with this blunt silver needle. It does quite a lot to change the circulatory pattern, and it's very effective. With Tanya, naturally, I'll treat points up around the occiput and along the cervical spine on the neck. She has a little cold right now, so stimulating the circulation in this part of the body is very useful for the cold. Touch and go, touch and go. No penetration of the skin, just touch and go. Okay.
Excellent. Well, thank you for that demonstration.
You're welcome.
And I think Tanya thanks you.